Okay, so my name is Shawnee Palencia, and this is my Nursing 451 PDSA project. My quality improvement topic was improving participant surveys for a community health teaching. And there we go. Okay. So for this next slide, it's for the PDSA cycle. My problem is improving the reliability of the surveys results in order to determine the best likelihood of the positive impact from the health teaching. So basically, I'm part of a volunteer group called Champions for Health, and we do community health teachings throughout the community. And in order to get feedback from the participants, we hand out surveys at the end of each session. So what we want to do is determine if there has been a positive change that has occurred after each health presentation. And the source that I used was another nonprofit called Unite for Sight, and they described how to develop quality health survey questions. Another resource that I used is I can't pronounce this, Kale and Tanabe, which is how to develop surveys for nursing research. And one of the things that they talked about was bias. There's researcher bias, there's participant bias, there's bias in how the questions are presented. So how you word a question will affect how people respond. And in order to get an accurate response from people, we have to word them carefully. So in my last resource is, again, I can't pronounce this very well, it's Boynton and Grenlaw from a British medical journal, and it basically this research says that through the surveys that we give to patients or our clients, in this case a client is the community, we can better develop learning needs assessment for that population. Next slide. Okay, so the quality variance of my project is based on the bias. So in order to improve the reliability of these surveys, we have to write the questions in a way that we reduce the likelihood of bias. We can't 100% remove bias, but we can at least minimize it. So for example, in the original survey that we've been using, one of the questions which tries to assess learning, the learning experience of the participant is, please assess your increased knowledge of health issues as a result of this seminar. Learned many tips or learned some tips. So this automatically has some bias in it with the word increased. So it's assuming that after reviewing this presentation, the participants have increased knowledge, and we don't have any way of measuring that. Even the answer says learned many tips or learned some tips. It's very nuanced. There's not a way that we can quantitate that. So I changed the questions to provide us a baseline, and having a baseline about our participants' knowledge is what we can compare to. So the first step in the nursing process is to assess, and the first process in our PDSA project is also to assess, so we can improve on that. So the question that I modified the please assess increased knowledge question to this. Before this presentation, how knowledgeable did you feel about the health issues in this seminar? Very knowledgeable, somewhat knowledgeable, no change, fairly knowledgeable, or not at all. So I chose it to word it this way because we don't know what our participants' level or baseline knowledge is. Maybe they already had teaching in diet and exercise. Maybe they're diabetic and they're very knowledgeable of managing their sugars, or maybe there's no change at all. we don't know because we need to assess what we're working with to begin with. Okay. So next slide. So the stakeholders in my project, once again, it's called Champions for Health. They used to be called, if I remember correctly, the medical, I think it's the Medical Foundation of Physicians Medical Foundation or something like that. And then they changed their name to Champions for Health just this year. And they partner with the County of San Diego's health initiative, which is called Live Well San Diego. I don't know if San Diego residents are too familiar with this. They do things like health screenings, blood pressure screenings, free flu vaccinations throughout the community. And the organization that I volunteer for is like an adjunct. We also partner with them and providing underserved areas the same services. Let's see. Surveys pretty much the same thing. So these are the stakeholders for my project. And the root cause analysis. So the issue is to how to better improve these survey questions so that we can get more accurate data. And the likely root cause is, again, the bias. And the assumptions are made that participants and the language used to deliver questions are causing an inaccurate measure of positive community outcomes. So how we word the survey questions, like back to the original question, increased knowledge, we are already assuming that we're doing a good job, but we don't really know that. So we have to kind of tweak the questions to be a little bit more objective. And the possible solution is to modify the language of the survey so that it accurately reflects the questions being addressed, and therefore providing more accurate means of measuring the effect on community health teaching. I must add that this is only a general statement. We're not analyzing content of the health teaching presentations, because that takes a little bit more in-depth, more time. So there's no time to cover that all in this presentation. So we're just trying to explore feedback, like how well does this presentation affect the participants. We're not really looking at the content yet. That's a study for another time. So this is the original survey. As you can see, right here it says, please circle the answer that best describes your perceptions. So it's pretty vague a little bit. So the importance of the subject matter, rate the quality of the speaker, overall quality of presentation, and would you recommend this seminar to others? I see what they were trying to get to here, but as we go along, I'll show you that it needs to be a little bit more specific. And this one here, please assess your increased knowledge health issues as a result of the seminar. It's probably one of the biggest problems with this survey right now. And do you think you will incorporate anything you have learned to your daily life? Again, a little bit vague, a little too general. We could narrow our focus a little bit more. So this is the demographic of where we operate mostly. This is area code 92113 and 92154, primarily Spanish speaking. When I've done presentations, it has been in English, but we do have Spanish, these same presentations in Spanish as well. So part of the solution is identifying our demographic. And this includes sex, age, race, ethnicity, level of education, and the language used in daily life, and other things like cultural factors. Continue on with the solution and the implementation. Again, it's imperative to have a Spanish version of this survey. So the original survey does have a Spanish counterpart, and for the new one, we would have to do the same thing. So the survey questions must be clear, specific, and concise so that the questions are interpreted in a way that all respondents will answer in the same manner. And that doesn't mean they answer the same question, is that they are answering the question that's being addressed. There's this term called construct validity, and that in which it's a type of bias in which participants' answer must be specific to what's being asked. That's kind of what I just said. So it must address the question. It can't be interpreted in different ways. And face validity, do the participants understand what is being asked? Again, this is about the bias, and it addresses the language being used. So the language of the survey, how the question is asked, the educational level of the participants, and may this affect, and this may affect this. And I have that example here. If you remember, the question is like, the original question was, how will you incorporate what was learned into your daily life? It's right here. Do you think you'll incorporate anything you have learned into your daily life? Yes, probably, maybe, or no. So the problem with this question here is the two answer selections, probably and maybe. It's a little bit nuanced. To participants, I know to me, they're kind of the same thing. So and one of the research that I read is that if the answer selection is too ambiguous, that's the safest answer, and that's the one they will go for. So it's not exactly going to tell you what you need to know. So there tends to be an inclination to reach for the safe answer. So probably, maybe in this case, is safer. So the analysis. After modifying the language of the questions asked, participants, their selection should include a quantitative aspect to accurately measure a difference from before the presentation and after the presentation. So that's gathering our baseline and assessing, gathering our baseline at the beginning of the presentation and assessing what's changed at the end. So timing is also pretty crucial. So when we do these presentations, we usually hand them out at the end of the presentation, but in reality, we should have almost like a pre-assessment to see where they're at, and then hand them this assessment to, the second assessment to see what's changed. One of the drawbacks is that long-term tracking of participation doesn't yield accurate results due to lack of commitment of participants, and without a follow-up survey, we can't really measure the likelihood that participants actually incorporated some kind of change into their lifestyle. So these surveys are pretty much right there, right now, done in real time, and we are telling them right after each health presentation. Right now, there is no long-term study being done to track the participants, because the research tells us they're not very good at following through with that, unless you give them some kind of incentive, like a gift certificate, money, or some kind of bribe. Bribes tend to work to keep people committed when doing these survey research studies. So as mentioned previously, we need a baseline. So I changed the question that we saw earlier to this one right here. Has your knowledge of health issues changed as a result of this seminar? Very, good, neutral, fair, or not at all. So I'm trying to make it a little bit more objective and a little bit more choices, like some people may choose not to answer, or they may feel it doesn't apply to them. So we have to give them those choices. So if we ask a question like this, we need a follow-up question. And that is right here. If yes, how has it changed? Greatly increased, somewhat increased, no change, fairly increased, or not at all. Again, we're not analyzing content. We're just analyzing the effect that the presentation has on the participants. Okay. And a tally of the results at the end of the seminar. This is what I mentioned earlier. Comparing the results would show a quick snapshot of the likelihood of change. However, due to a small sample size and applying the results to a much larger demographic wouldn't be feasible, not without a larger population to pull from. So many more surveys would need to be conducted over a period of time, and the results of those surveys need to be pulled together. The effectiveness of the modifications to the survey will produce a clearer picture of the health needs of the community that Champions of Health is serving. More specific questions in the language and the local community uses will help pinpoint where the learning deficits for health teaching are. As more survey results are reviewed with the new psychometric data, we can better customize our survey questions. So the new survey that I created is presented below, and here it is. So it's a two-part survey, one which rates the presenter. How is the quality of the speaker? How is the overall quality of the presentation? How likely would you attend another seminar? And how likely would you recommend the seminar to others? The second part is rating the experience, the learning experience. This is where the learning assessment begins. So this first question, I was just trying to try to establish a baseline, but again, ideally we would have a pre-assessment at the beginning of the presentation, followed by this survey, gauging how much has changed after the presentation. So I'll just read the first question. So before this presentation, how knowledgeable did you feel about the health issues in this seminar? Very knowledgeable, somewhat knowledgeable, no change, fairly, or not at all. And has your knowledge of health issues changed as a result of the seminar? Very good, neutral, fair, or not at all. And if yes, how has it changed? Greatly increased, somewhat increased, no change, fairly, not at all. Excuse me. And after viewing this presentation, how likely will you incorporate what you've learned from the seminar into your daily life? Very good, neutral, fair, or not at all. And if so, what will you do to change? Please write in the comments section below. So I left that alone. It's the narrative portion that they can fill in. And the next two slides is a clearer version. There it is. And the second part. So this is the new and improved survey that I will be presenting to my volunteer group and see how they like it. Right now it's been pretty informal, as you can see from the first original survey. They're not really conducting any studies, but what I hope to accomplish is that after using a survey like this, they can better tailor a learning needs assessment survey. That way they can tailor specific teaching content to the areas that they serve. One of the big ones is diabetic teaching. The one presentation that I have done has been health teaching and exercise. Haven't done the other ones. And then the next hurdle is translating this in Spanish and presenting it in Spanish-speaking communities. So it's a beginning, it's a start for a much larger project. And these are my references. Okay, again, my name is Shani Palencia. This is for NURS451, and that was my PDSA project. Thank you.